G3 Assistance through Virginia's community colleges is your pathway to a new future, helping those who qualify pay for school and train for the right career. Right where you are, right now. Get a skill. Get a job. Get ahead. You can learn more at vccs.edu/G3.
This is a CBC podcast.
Now, we're one day into our new mask mandate, the mask mandate being lifted in most indoor public spaces, and there's mixed feelings about it. Lots of people out there are still wearing masks in indoor public spaces, and that's actually being encouraged by health officials and many businesses. With kids still not vaccinated, the ever-evolving variants, and continued large outbreaks elsewhere in the country, many are not sure if we should ditch the masks just yet. Dr. Catherine Donovan is a retired professor of public health and a former medical officer with Eastern Health, and she joins us on the line now. Good morning.
Good morning.
So masks are not required anymore in most indoor public spaces, but what's your advice on the face covering? What should we be thinking about when it comes to masks?
Well, certainly the epidemiology in this province right at the moment does support the removal of a legal requirement for wearing a mask, but I do believe there are certainly circumstances where common sense would tell us that a mask is appropriate to wear, considering that we really don't know if and when we may have increasing cases. So the environments that I'd consider to be risky would be ones where they're likely to be crowded spaces, where there are people that you don't know and where you wouldn't know what their immunization history would be, places like crowded shopping centers, or entertainment events, those kinds of places. I would be particularly concerned, too, if you had somebody who was vulnerable at home. You may be fully immunized, but we do know that people who are fully immunized are capable of picking up the virus and passing it to other people. So if there's someone in your home that's not immunized or whose immune system is not healthy, or if you have an elderly person in your home, I'd certainly be considering wearing a mask in indoor crowded spaces for sure.
Now, one of the things that we've noticed over the last few weeks and months has been, this easing of restrictions. So, a capacity being increased, dancing being allowed again, and now the mask requirement being lifted in many spaces. What should we be keeping in mind as some of these things change? I was in the grocery store the other day. I noticed that the arrows on the aisles were now removed. And as we see the easing of restrictions, what should we be keeping in mind around things like social distancing and the amount of people we're gathering with?
I think that certainly the issue of distancing has been a concern for some time. As long as we have the cues, such as the circles and the arrows, we're inclined to follow them. But as those are removed, people are less mindful of distance. And I've certainly noticed when I've been shopping that people aren't conscious of where they're standing and in relation to other people. So that would be a circumstance certainly where masks would be appropriate to continue wearing. And I still think that it's wise to consider where you're going and who you're spending your time with. Obviously, if you're spending time with people and you know their immunization status, their travel history, then you certainly can be more comfortable going into people's homes. If you're going into environments where you don't know the people or their history, they may just have gotten off a plane. They may be somebody that has just one vaccine because they can come to the province now. No quarantine or testing is required. So there are still risks out there, and you should be cautious. We don't need a legal mandate to be cautious.
Now, it's less than a month away till children are back to school again, and there's still no clear indication of a vaccine ready for children under the age of 12. Some parents are, might be a bit nervous, and justly so. Do you have any sense of when that vaccine could be coming for that age group?
There is some suggestion that a Pfizer vaccine may be available early in 2020. 2022. I think Moderna is going to be sometime later than that. I believe I've heard that may not be available until 23. So even if a vaccine is available in 2022, there are going to be a lot of countries looking for it. So I think we probably will be late probably getting the vaccine. There'll be a great deal of demand on it. So we're going to have to be cautious with children for certainly the next little while and as they start going to school in the fall.
Now, when it comes to the Delta variant, that's something that's being discussed quite a bit lately, especially across the country as we see that kind of driving the numbers when in new infections. What information do we know about their impact on children, especially because they're a demographic, the under 12, that aren't vaccinated right now?
So one thing we know about the Delta variant is that it is more easily transmitted than other variants that we've seen. And because children are not immunized, we are certainly seeing more cases in children. And because we're seeing more cases, we're also seeing more children hospitalized. There isn't any evidence at this point that it is more severe than the other variants in children, but because more children are getting infected, we are certainly seeing more children hospitalized and more children with severe disease just because the numbers are higher. So it's something we should be concerned about in children, but not overly concerned. Again, just be cautious. Try to ensure that you know where your children are going, who they're playing with, and try to ensure that those who can be immunized in the environment where children are immunized.
Now, as we get closer to the fall, not only school is on the radar, but many folks are, talking about going back into the workplace if they haven't already been. When we're considering that return to the physical workplace for those who've been able to work from home, what are some of the considerations we should be making?
I think we still need to think about the environment that we're going in. If the work environment is crowded and their desks are close together, I still think it's advisable for workplaces to think about how they want people to work. Maybe it's time to think about working differently. Maybe we can have half of the office in for part of the week and the other half the rest of the week to try and maintain the distances. It may still be wise to be wearing masks in the environment. If workplace needs to think about their ventilation. And these are things that should be thinking about regardless of COVID, but COVID has given us the incentive to think about. There are other added benefits, both social and environmental, from considering how workplaces operate.
Dr. Donovan, thank you so much for your time.
Thank you for the opportunity.
Dr. Catherine Donovan is a retired professor of public health and a former medical officer of health with the Eastern Health Region.
For more CBC podcasts, go to cbc.ca/podcasts.